Mark Peterson, it's great to talk to you.
Good to talk with you, Harold.
Maybe we'll start with who are you and what do you do?
Well, I am Mark Peterson, as you said, and I'm a professor of public policy, political science, and law at Luskin School of Public Affairs here at UCLA.
And in terms of the J. Hipple world, it's you're a distinguished former editor of J. Hipple. I should say this conversation we're having is part of the 10th anniversary of the ACA, and you're a contributor to a special issue which kind of appraises where the ACA is at this critical juncture. So it's especially good to talk to you.
We do this at J. Hipple every time there's a major healthcare reform event. So we have a why it failed, usually, or why it succeeded, and then what happened some period later.
And your piece that you wrote, which is called The ACA, A Decade in Resilience, Impact, and Vulnerability, it's sort of about how there's things about it that have proved really successful, and there's also things about it that have proved, quite vulnerable, and it's unusual that it has not become more entrenched after a decade compared to, say, Social Security and Medicare, which really are, and for that matter, aspects of Medicaid, which became just part of the bedrock. And I'm sure we'll get into that in the conversation. But maybe I'll start with one question, which is, why do you think the ACA was so vulnerable to being repealed? It came within John McCain kind of doing one thumb thing to being repealed.
But I think the vulnerabilities go to the whole environment in which the ACA was originally enacted, and with the polarization that really had set foot so dramatically into Congress by that point, and ironically in a way that made the strategy of the Obama administration to bring in Republicans all the more unlikely. So first you had the massive polarization. You can just look at the data and see how the two political parties in Congress are in completely different ideological zones now. And part of the irony there, as I said, is that if you go back to the early 1990s, the Republican response to the Democratic efforts at the time had been what essentially became close to Title I of the Affordable Care Act, which is a system of private insurance subsidized by taxpayers, allow people to be able to buy insurance in the marketplace with a personal responsibility component of the individual mandate. And that was supported by the Republican leader, Robert Dole. It was supported and crafted by John Chafee from Vermont, a lead Republican on healthcare issues. I think it had 22 co-sponsors, a total of 22 sponsors. So that was a significant Republican effort in the direction of something resembling a pathway to universal coverage. You move forward to 2009, 2010, or particularly 2009, when the bill passed in the Senate. Of those 22 Republicans, I think 6 remained in the Senate. And not only did they not support the bill, they didn't even participate really in serious negotiation in some ways over the bill. And then you had the relationship between Matt Baucus, chair of the Finance Committee, and Chuck Grassley, the ranking member. They were, in a sense, the Bobbsey twins of the Finance Committee. Each time the party controlled the chamber change, they would simply switch seats, but they became very good friends. They had a lot in common in their orientation. They tended to work together extremely well. Max Baucus, who was one of the leaders on moving this version of healthcare reform through the Senate, really thought he could strike a deal with Chuck Grassley in order to bring on Grassley and some other Republicans, driving the White House crazy as that went on and on through that summer of the almost violent town halls over this issue. And in the end, when the president asked Chuck Grassley effectively, well, what will it take to get you on board? And he says, well, frankly, no matter what you do, I can't support this bill, because what he's conveying was that the Republicans would not allow that to happen. So the partisanship had become so stark in those terms that even with something that started off in many ways as a Republican idea, couldn't bring the modern Republicans along in the Senate. The second part of the vulnerability goes to the very strategy of building a healthcare reform plan, not by replacing anything, but by building on the existing structures and doing most of the real reform within the context of the individual insurance market. Well, that meant it was an enormously complicated bill. Most people did not know to what extent or not they were going to be affected by it. And one of the surprising elements of the Affordable Care Act is almost everything in it, except for the individual mandate, but almost everything in it was extremely popular with the public. We know that from the series of Kaiser Family Foundation surveys. We know it from the survey that I participated in the Cooperative Congressional Election Study in 2018. Those components were very positively received by the public, but to a very large extent, the public didn't know they were in the Affordable Care Act. This is at the time during 2009, fall into winter of 2009. I kept thinking, and said this to a few people in the process, that President Obama really ought to do a series of 5-minute talks on television, kind of fireside chat type talks, maybe every other day or a couple during the week, in which you'd say, tonight I want to talk to you about the Affordable Care Act, or whatever the title was at the time, and what this will do for you if you have employer-based insurance. Or tonight I want to talk to you if you're parents and you have children, what this will do for you. Or tonight I want to talk to you if you're a young adult just leaving college and going off into the job market and what it will do for you. Or if you are a woman of childbearing age, what this will do for you. Or if you are a person with pre-existing conditions and disabilities, what this act will do for you. And really make it crystal clear, subpopulation by subpopulation, what is in the bill that will transform their relationship with the health insurance system and the healthcare system.
Now, why didn't the president do that, or did he try to do that and it just didn't penetrate the, the fog of war that is the American sort of media environment in a polarized time?
In some respects, they didn't do that specific strategy. In some respects, certainly the White House felt they were doing a large part of that. One of the responses I heard is that this president's talking about this bill all the time, and wherever he's going, he's talking about it. He's talking about these different elements, but it wasn't done in a way that was going to be targeted or was going to get the recognition of a particular person to understand how that person was going to be affected by the act. So yes, a lot of presidential time behind it, a lot of speech making, some quite extraordinarily powerful speeches, such as President Obama's September 2009 address to a joint session of Congress and therefore to the country, but not this systematic effort to get people to understand these various aspects of the bill that were found throughout a number of titles in it.
And so ACA passes, and one of the things that you point out in your article is that it becomes, in some ways, it's really catalytic in the political catastrophe that Democrats suffer in 2010 and beyond, both at the state level and in Congress. And Republicans just really, the backlash to ACA really is one of the factors that leads to the Republicans taking over the House and for many state houses as well.
Yes, and the other thing about it, which I should have mentioned before we get into this particular question, is the other thing the ACA lacked compared to Medicare and Medicaid or Social Security, and somewhat related to what I already said, is it lacks simplicity. And so there was not a simple message about it. That meant that when you got into the 2010 campaign at both the national and state level, you still had people who didn't know what was in the bill. It lacked the simplicity of being able to have a clear characterization that one could have for something like Medicare or Medicaid, and therefore made it all the more open to interpretation, attack, death panels, and this is a government takeover when it was the least government takeover of any democratic version of healthcare reform in the history of the United States. And so because of that vulnerability, and then you throw that into the partisan landscape, and part of that partisan landscape was the mobilization of a pretty hard right part of the population. In a way, this was represented by the Tea Party movement. And of course, the Tea Party movement really was a series of activities that took on the character characterization of Tea Party, a lot of it mobilized and financed by some pretty long-standing resource-rich enterprises such as the Koch brothers network. And so, but it created the opportunity for it to be characterized in any way that one wanted to do it. It's got to be, if you wanted to find a way to have a negative theme, you could find something in the ACA to do that. That helped mobilize the rights, and that mobilization of the right really helped to take over in 2010 of the House and of many of the state legislatures at the time. It was, without that simple message, without the simplicity, without a theme that people understood, without a sense of where they stood in the law, it made it vulnerable to that kind of attack.
What I find so frustrating about that, though, is that it's true that the ACA lacked simplicity, but the reason it lacked simplicity was because it did try to protect so many things that people valued and they had. And, you know, when you look at, say, Medicare for All today, that you could have, you know, Senator Sanders in some ways presents a very simple message, which could be characterized as, you know, those people who fucked up the ACA website, they're going to be in charge of your health insurance, but don't worry, it'll be great. And you know, there's so many protected publics, as Paul Starr puts it, who really don't want to see our health insurance disrupted. You know, I have private insurance through the University of Chicago. My wife had a heart problem. It was dealt with effectively through our gold-plated insurance. If somebody said we're going to take that away, you know, I would balk at that. And that's, so there's a sort of trade-off between the need for incrementalism to protect things that people genuinely value, and to understand also that the apparent simplicity of, say, Medicare for All is in some ways illusory, because of course it would have to be the most complex piece of legislation and implementation we've ever tried. If you actually tried to rewire the entire American healthcare system, it wouldn't actually be so simple, even though it would be simple to explain when the law was being enacted in some ways. So, I mean, it seems to me that there's a real dilemma here, because whichever way you go, there are vulnerabilities, complexities, and screw-ups that are going to be part of what you do.
Well, you know, Harold, life is unfair. And let me
now
say,
you tell me.
A number of somewhat disjointed things. Mm-hmm. Number one, I remember when I was working in the Senate for Tom Daschle, and we were doing a big healthcare reform plan at the time, and Robert Blendon from Harvard was testifying before the Finance Committee. And he was always a delight to have there. He's very kind of the exemplar in how to present to the United States Senate. Mm-hmm. At one point, he said, this is going back now before the Clinton reform, but building up to it. He said, whatever you do, call it Medicare, because Medicare is so popular. So in some ways, the simple message is simply to call it something that people think they understand, and then move forward with whatever way you can. But I want to get to that in a moment with the Medicare for All.
Yeah.
The second thing is, you're absolutely right. The irony of the ACA is Obama and the Democrats have decided to build on the existing system and disrupt as few people as possible in the route forward. And that, I think, is why when President Obama was saying, if you like your doctor, you can keep your doctor. If you like your health plan, you can keep your health plan. He was essentially recognizing that upwards of 88% of the public was going to already have an arrangement that was not going to change fundamentally. It was going to be in the individual insurance market, and there were going to have to be some changes, but it really wasn't front and center in the law. Well, the moment, of course, there was anything happening at the margin in the individual insurance market, and people lost their doctors, and there was the outcry, you lied, Mr. President, you lied, Mr. President.
This PolitiFact's lie of the year.
Yes, absolutely. Now you come to the Trump administration and Republicans in 2017, and all their characterizations about protecting pre-existing conditions, that was absolutely fiction. And yet it's not even remembered as being a lie at this point. It must drive President Obama rather crazy to see these divergences.
Well, it is sort of it. Well, go ahead. Make your point.
Well, I was going to go then to Medicare for All, but if you want to follow up on that first, please do.
Well, just two things. One is the people who really explained what was in the Affordable Care Act were Republicans who tried to repeal it. Yes. And all of a sudden, all of the things that were popular in the ACA, a lot of Americans, and things that were either protected or things that were added in the ACA that people valued, like the Medicaid expansion, all of a sudden, um, people really had to confront that and didn't like it. And one of the things that's really striking about the ACA is, for all of the things that were done wrong with ACA, there was this period between 2006 and 2009 when Democrats actually got together and put together what became the ACA. People call it Obamacare, but it would have been Clinton Care, would have been Edwards
Absolutely.
Care. There's nothing
Absolutely.
Obamacare about that particularly. Uh, uh, and Republicans didn't do that. And I mean, one thing about Obamacare, it actually was a feasible piece of legislation, not only to pass, but actually when enacted, for all of its faults, it actually was doable. And one of the things you point out is that the Republican version was really self-immolating. As soon as CBO got a look at it and said, 23 million people losing their health insurance. Remember that at one point, a 64-year-old woman uh, under ACA who had an income of $26,000 a year, maybe it's 26,500, I've forgotten. Her income, her insurance would have gone from $1,700 a year to more than $13,000, and that was a figure in the Congressional Budget Office's report. Which, by the way, I'm sure somebody paid attention to that. There's a reason why that ended up as a figure, I think. But I mean, that is so incompetent, and I think that the thing was just dead on arrival,
Well,
in an interesting way. I'm sorry, go ahead.
there are a couple things here. One is, as you pointed out, what the Republicans managed to do is really focus attention on what the ACA did for people by putting them at risk. And so they performed the magic that I guess at that time only they could do, which was to make the ACA more popular with the American public than it had been at any time in its history, which
Yes.
is a rather ironic way to go after it and try to repeal it.
Mm-hmm.
There is something, again, it goes back to the polarization. And part of what happened in 2010 with the Republican takeover of the House was not just that there were more Republicans and therefore they had a majority and they took over. They were a particular kind of Republican. And it goes back to that Tea Party mobilization. The part of the Republican caucus or conference that really grew dramatically was that set of people who constituted the Freedom Caucus. And they became a substantial anchor, an ideological anchor within the party ranks that made it very difficult to move off of where they wanted to go, which was essentially a truly stripped down federal government role, not only repealing the ACA, and not only getting rid of the Medicaid expansion, but actually in many ways returning Medicaid itself back to some more primordial roots of much less generosity, much less expansiveness, and in the process of going to this notion of some version of block granting or per capita spending caps to supposedly create market flexibility, in the end would have enormous consequences on how many people the states could cover. So they were really driven by an ideological imperative there. They're also driven by a fundamental change that occurred among Republicans in Congress when you compare, say, the Congress of the early 1990s with the Congress of 2017. And that is the people like Bob Dole and others were not happy about big government instruments, but they were still committed to the notion that people ought to have insurance and that insurance ought to provide some kind of decent coverage. The Republicans of 2017 and onward their belief is what we need to do is simply create a market where people can buy insurance, whatever it may be, at the lowest possible premium, regardless of what happens to their out-of-pocket payments. So they explicitly said, we are not committed to universal coverage. We're not committed to moving people in the insurance system. We are committed to lower premiums. And if that means a stripped down plan that does very little and you choose to buy it, that's fine. And that's as far as we want to go. And if you need a little bit of money because you are a poor single mother, okay, we will do that to support you. But they really moved off where they were in the past. The second element of that is during the course of 2017, Paul Ryan, as Speaker, at one point pointed out that among the Republican ranks at the House at that time, only 64% had never served in Congress with a Republican president.
Wow.
They had never been part of a governing party. And being a governing party is a party that has to compromise, has to work through these issues to get to an outcome. If you're not experienced with being a governing party and you're driven by ideological orientation, then the capacity to do the things you need to do to hold together a coalition that gets you to majorities in both chambers of sufficient size to enact complex legislation and send it to the president's desk, you're going to have a problem. And that's particularly pronounced when that third institution over there, the White House, has a president who has absolutely no experience in governing, no experience in that kind. That's where we usually look to. The president of that party is supposed to be leading the charge in both the setting the direction of policy and having people with the president who can help orchestrate that coalition. Well, Donald Trump had no capacity in those ways, so he didn't have any government experience. Almost no one around him in the White House had real governing experience. And certainly he himself and most of the people in the White House and even in the cabinet had very little policy knowledge about what goes into healthcare in the system. One of the slides that I have when I do presentations is 3 pictures and quotes of Donald Trump at various points in time. One early on in 2017, where he says, effectively, who knew how complicated healthcare was? Which, of course, you and I shake our heads because we've known for a very long time just how complicated it is, even after decades of working in the domain. Yeah. Then about 5 or 6 weeks later, there's another quote where he says, well, first I really didn't understand all these things, but now I know all there is to know about healthcare, which is an astonishing kind of statement. Of course, now we're very used to those kinds of statements from this particular president. Yeah. And then about 5 or 6 weeks later, a story in the National Review, which is obviously a conservative outlet, in which a reporter covering the efforts in the Senate by the Republicans to forge legislation to repeal the ACA, they're all looking at one another and saying to the reporter, they really get the impression that the president doesn't have any idea what's in their plan and what he's trying to achieve. And so if you have so many members who've never been responsible for actually getting to an outcome, and you have a president who has none of the normal traditional capacities to lead the legislative process with the leaders in Congress, they were, and you've got such a strong ideological lens, they were really left at sea with any capacity to do this in an effective way.
But an anecdote about that. By the way, I don't think they ever expected to win the 2016 election. Right. And I think that an extremely effective counterpunching argument against the ACA, that it made health insurance too expensive, that it was really stupid, that there was a way out that would protect everything that people valued and wouldn't be this stupid Obamacare. And they didn't do the actual work of coalescing interest groups and stakeholders and public messaging that actually matched what they actually were going to do as a piece of legislation. And then that put them, as you point out, when the Graham Cassidy comes along, it's endorsed by like 5 out of 114 right. stakeholder groups. That's a failure of doing your homework, and that's something. But the other thing, in early 2017, I was invited to a dinner with a bunch of Democratic and Republican congressmen at an event, and it was really striking how the Republicans were very glum at this. They had just won this big election. Trump, was new president, and I got the impression that a bunch of them could see this coming. I remember there was one very conservative gentleman I was talking to, and he said, "The president is talking the way I talk, and that's not what I want. What I want is for the president to do things that creates pressure on purple state Democrats to work with me. And what he's instead done by everything about his campaign is he's made it radioactive for anybody to work with me." By the way, they also were very, very angry at the Democrats and the way the Democrats had railroaded them in the House when the ACA was passed. Which I was not so familiar with. I was very familiar with the Senate, where the Democrats had worked so hard to bring in Republicans. Right. In the House, the Republicans were like, they just never even they obviously completely stomped on us and had no interest in working with us at all. And so we're going to this is payback. Uh,
Right.
but what was amazing was in 3 hours of very detailed conversation, it was two things were really obvious. One is the most of the Republicans in the room did not know that much about healthcare. They were really smart. They were just as smart as the Democrats, but they were not into healthcare. They were into whatever their other issues were. A lot of Democrats really go to Congress because they care a lot about health insurance and health
Right.
Coverage. That's not a lot of the Republicans were, I'm here representing an energy district. I'm interested in lower taxes or defense or whatever. I remember one gentleman asking me what the Center on Budget and Policy Priorities was. And he's a smart guy. He just wasn't into
Hmm.
social policy. But second is no one at any point referenced any policy guidance from the White House at all. No one ever said, well, this is a tough issue, and the White House has said we really should focus on X rather than Y, or this is. It was clear that they were on their own, and there were
Yeah.
all these complicated collective action problems that they had, that there was no central coordination that was going to be possible uh, because of all the things that you said. And I got the impression they were no happier than the Democrats in the room who had just been clobbered, in the election. And
Well,
go ahead.
anyone of experience in the Republican ranks were going to know that this was not a prescription for effective leadership of a complicated policy process. One of the things, it's certainly the case that there are relatively few Republicans that make healthcare a front and center issue for them. One of the things that struck me every time I read a document that was put out by Paul Ryan's office, the titles for what they wanted to do with the healthcare system, what they wanted to do with Medicare in particular, and so on, and you look at the footnotes, there is not a single footnote to anything substantive. There is no grounding in anything that has been generated by the research community, even from the American Enterprise Institute or from even the Heritage Foundation. There's just
Yeah.
nothing that is rooted in real knowledge about what works and what doesn't work, or what's ambiguous, what's complicated, and what the implications are going to be. And so the detachment from the realities of how you actually make any of this work is just stunning.
Yeah.
And again, the president hardly led the way in reversing that. That's the way he operated in spades as well.
But by the way, it's a very good approach if you don't expect that you're going to be in a position to do anything. You don't need to be substantive
Right.
if you're attacking. Uh,
Right, unless you're trying to build the long term. Remember what happened. You won't remember this personally, nor do I personally. But remember what happened after the 1958 election. This is during the Eisenhower administration, middle of the second term. The Democrats come in a big way. And what do? They generate a lot of legislative initiatives. They know they're not going to go anywhere. The president's not going to sign them, or he may veto them if they pass. But what they were setting up was the ongoing Democratic agenda, should there be a Democrat in the White House.
mm-hmm.
And if you look at what John Kennedy advanced in the New Frontier, and eventually what Lyndon Johnson advanced in the Great Society, a lot of that had roots in what the Democrats in Congress did in the late 1950s. Mm-hmm. And so it depends on what your orientation is and how you imagine the process works. Mm-hmm. And as I teach with my MPP students about the political process, a lot of the cases we go over are stories that are 10, 12, 15, 18, 20 years long. And anyone who's done any work in the healthcare field knows that healthcare reform issues, one way or the other, have been on the agenda in some sense for over 100 years. So this is a long, drawn-out process, and you have to be able to think beyond next month, next year, or even just this one Congress.
Now, maybe that's a good segue to Medicare for All, because in some ways that is the animating passion around many, many Democrats who wish to go beyond the ACA and the ACA's shortcomings, as both shortcomings that they see and shortcomings that everybody can see, that are obvious about the ACA. And there is a sense. I mean, it seems to me that if a Medicare for All bill were actually put down in Congress right now, it would be like the Republican bill. It would self-immolate once people got to look at what it was really going to do. But maybe it's doing something that you're describing. What's your take on the role of Medicare for all as we move forward uh, into the next whatever we move into?
Well, I think I, always make a distinction between what you have to do to have aspirations and motivate and develop a social movement of some kind in favor of a particular policy direction. And then what you have to have is a governing strategy or a theory of governing about what you do once you actually get into office and you're facing the particular parameters of the political environment at that moment. And what you need is leadership that's able to do both things. And right now, let me just say, I think, certainly as I've talked to, you take someone like Senator Bernie Sanders, who's got the aspirational sense, been at this for decades, this is his theme, this is what he's pushing, Medicare for all, and I want to say a little bit more about that in a moment, but it's not clear he has a governing strategy or governing theory. I was on the edge of my seat when he was asked in one of the debates, Senator Sanders, you've got these ambitious plans. What exactly is your plan or your orientation or your strategy for getting this enacted? And here's an experienced senator. He'd been in the House beforehand. He's run a little city, so he knows that how you actually get the potholes filled. And what was his answer? We're going to have a political revolution. That is not a governing strategy. It's not a governing theory of governing in the American political system. So he has the aspiration, but not the governing theory. The other thing about Medicare for all is it can mean many different things. As Bob Blendon said, if you have Medicare in the title, that already draws some favorable attention. And a lot of people support Medicare for all because they like that general idea, but they're not looking at the whole bill. Number two, Medicare for all, as Senator Sanders has crafted it in the Senate and as it's been crafted in the House, are so expansive that, in fact, if they were to be enacted, they would leapfrog the United States from last place to way, way, way ahead in first place internationally, because nobody around the world has the combination of comprehensive coverage, no cost sharing or out-of-pocket expenses, inclusive of dental care, vision care, and long-term care, all in one big package. That's just, imagine trying to do that in a system of separation of powers and all the points of fragmentation and veto points we have. They don't have that in New Zealand. They don't have that in the United Kingdom. They don't have that in any majoritarian system where a majority party can come in and simply snap its fingers and make things happen. So it's an astonishingly ambitious, even though one can make substantive arguments about why people should have dental care and vision care and so on.
And an excellent disability plan, yeah.
An impossible thing to imagine in some ways. And then to throw in, you're going to get rid of private insurance. Well, I have great private insurance. I'm not particularly fond of the private insurance per se. I don't like the insurance company that is the third-party administrator for our plan. But and I probably would be happy to switch to a government-run insurance system. But for a lot of people in this country, they have more faith in private institutions. And one of the things you have to look at is in the mid-1960s, when Medicare itself was enacted, about 2/3 of the public had the view that you could trust the government all the time or most of the time. That figure today is 17%. So how are you going to get a public behind something that's going to get rid of all the private institutions within it, put it all in the government's hands when only 17% have that kind of faith in the federal government? The second thing is, there's really no need to do that. I think Mark Schlesinger and Jacob Hacker wrote about this some years ago. Why don't we take Medicare as it is in some ways with the due changes in benefits and have the similar kind of structure? Right now, about 1/3 of the people in Medicare choose voluntarily to have their benefits delivered to them, their services delivered to them through a private insurance company. I might think that's a crazy idea, but they've chosen to do it. They would be a lot more comfortable if they could hold on to that insurance that way. And I can imagine if we had a Medicare for all of some definition that it also said, hey, if you want to get your services and benefits through a private insurance plan that is basically contracting to do the work of the government plan, so be it. It might add some administrative overhead. It also adds some degree of innovation. There's some evidence that there's a high degree of penetration of the Medicare Advantage plans. There is some evolving changes in what is happening in the delivery of care that can be advantageous to everybody. So the notion that you're just going to get rid of that is politically a non-starter and simply shooting a revolver right into your foot when there's an opportunity to build this forward to a truly universal coverage system that doesn't have to take on all those demons. And then, Bernie Sanders talks about the $100 billion or $200 billion of profits that the insurance industry and the pharmaceutical industry gets out of the system. That is, as much as I understand the worry about decisions in healthcare being driven by for-profit orientations, that's an argument one can have. But that amount of profit in the system is in some ways spare change, given a over $2 trillion, moving towards $3 trillion healthcare system as it is. So why have that fight?
Now, let me ask you a question. One of the legislative theories is a lot of people understand perfectly well what you just said, but say, if we're pushing for Medicare for all, then all of a sudden everything else becomes more moderate and more feasible. And all of a sudden, Harold's plan that everybody over the age of 50 could sign up for Medicare, he's like the neoliberal sellout. And that we've moved the goalposts in a way that makes everything else more feasible, even though Medicare for all, the way you just described itself, really can't be passed. What do you think of that as an approach to moving the legislative goalposts to make something more that is actually more radical seem to be more moderate?
Well, two things. One is it could be, but it still has to survive a certain kind of laugh test for people inside the system. It can't be so far out there that it doesn't have some traction to move the whole play on the field in that direction. Number two, you have to worry about if you get people whom you need to be really agitated in calling and writing and social networking with their representatives. If you get them so attached to an idea that anything other than that is as you say, a loss of purity and put you into the camp of darkness, then you're going to lose those folks when you do have to do the final compromising. And when Clinton lost on the Health Security Act in the early 1990s, one of the counter questions was, well, what if he had simply proposed single payer, and maybe would have ended up with something and something better than nothing as a result. And of course, it's very hard to know whether or not that would have been true. It's hard to know what the counterfactual would have been. And after all, the Clinton plan was attacked as being socialist and government takeover anyway, so why not do the real thing? But there are a lot of Democrats who would have, in Congress, been made a lot more scared by trying to move in that direction at the time. Same with Obama. And as you say, it was not just Obama. It was John Edwards, it was Hillary Clinton. It was essentially going back to John Kerry in 2004. It was essentially where the Democrats had gravitated to in trying to find a pathway forward. And they were trying to not just get Republicans, they were trying to hold on to Democrats. And you would have potentially scared away a lot of Democrats who were in the center or in the conservative wing of the Democratic Party who were going to be absolutely needed when it came to the votes in the Senate, for instance. And it may have just made it too difficult to move forward. And you might have then lost also those who were the most dedicated to the most government-based approach, who weren't going to be satisfied with whatever came forward. It's awfully hard to know what the counterfactuals would be in this case. I do worry. I mean, the one thing that gives me some sense of the greater sophistication than we might not see in public is I was on a panel with Pramila Jayapal from the state of Washington, who has introduced the House version of the bill. Very impressive person. And, her bill is very similar to Bernie Sanders' bill. It's very expansive. And in the course of this discussion we were having for a group of West Side LA Democrats, so not exactly the center of the conservative movement, I was raising these kinds of issues, and her response was more or less to say, I'm happy to have those conversations if we're actually getting to the point of having that debate. And it was a way of saying, right now, what they are trying to do is mobilize. Right now, what they're trying to do is excite. Right now, they're trying to, she's a community organizer. Right now, what they're trying to do is to get people really activated about the need for universal coverage and moving forward. And yes, the final details are going to be open for all kinds of debate and conversation. But let's get there first. And what I'm doing is using something that is going to get people to really get behind in a big way. I remember years after the Clinton effort failed, and when I was working for Tom Daschle, it was the first year that Paul Wellstone had entered the Senate for Minnesota. And he latched on to Daschle in some ways as his mentor. And so we saw a lot of Wellstone. I got to know him a little bit. And some years after the failure of the Health Security Act, I was talking with him, and he said, you know, what we really need is we need a social movement. You just can't do something this big, this important, without having a real grassroots orientation to it. And to some extent, I think part of what a number of people in the Medicare for All movement are trying to do is ignite that. But it has to be done in the right way that allows the aspiration to energize the debate, but doesn't get in the way of the governing that needs to happen after the election is over.
The two things on that, by the way, that there's no question that, especially among younger people, there is a lot of excitement. I mean, the generational divide on this is
Yes.
so dramatic. One thing that I was an advocate of the public option during the ACA debate, and which in some ways is the sort of Medicare for more. And one of the things that was very striking to me was there was a real undertone of opposition to it among people who were our allies on everything else. And it wasn't the pharmaceutical companies and the insurers. They are not that powerful. And they poll some, I think Ezra Kleinman said that they sort of poll with Bernie Madoff, in terms of their public standing in a lot of ways.
Right.
Certainly the insurance companies, I have a relative who was a vice president at a community safety net hospital in a rural area, and she was talking to her congressperson all the time, and she's like, we're the good guys. We are, and if I have my 58-year-old heart failure patient and I'm across the table from Medicare the way I am with my 68-year-old heart failure patient, I'm really worried about whether we can keep our doors open. And I'm not real excited about government having more leverage on me as a safety net provider, in this community. And it's interesting, as a political philosophy, the big story of 2020 is this incredible grassroots mobilization among moderate Democrats. That basically when Medicare for All really looked like Bernie Sanders was really going to take this thing, a ton of ordinary Democrats, in the face of a somewhat ineffective Biden campaign, basically said, we are actually really, really scared that this is a huge political mistake, and crushed. It turns out that the ordinary grassroots Democrat is really, really nervous about betting the House on something this radical, and particularly in the Trump era. That was the South Carolina primary. All these older African American voters and others saying, please do not make this a referendum on democratic socialism and taking away people's health insurance when we have to remove President Trump from the White House. And so it's not exactly clear who's going to be more mobilized, and there's lots of people in America who can become mobilized in lots of different directions. And it's not clear that a Medicare for All approach is going to, that the counter mobilization won't be actually larger than the mobilization.
That's a very fair point. And the one thing I think a couple things to note about that is that it is thinking about, I think those people are thinking a lot about how is that going to be, that Medicare for All approach going to be framed in the campaign by the Republicans going into November. And even though they might personally be in favor of rather significant changes in the healthcare system, and some at least really big fixes in the ACA, they worry about just the politics of what happens in November.
Fair point.
The second thing is, and this is something that we tend not to talk about because we get very siloed in these areas, one of the problems of thinking about Medicare for all and a shift to a full single payer system and I accept, in fact, I helped write a bill for Senator Daschle that was effectively a single payer bill that also had a role for private insurance plans. And so if I could write the legislation as I helped do, I would like to move in that direction. But one of the things about it is you have to deal with the financing. I think, in fact, in the long term, it will cover everybody at lower cost, not just for individuals overall, but also for the system overall. But that's still a significant shift of resources from the private sector to the public sector. And we can have that conversation only in our little domain of health and health policy. But there's also the proposal to erase student debt and to make all public colleges and universities tuition free. There's also the proposal to put $1 trillion into infrastructure. There's also the, so you add them all up, and that becomes the heavy weight that has to be carried into the November election. And I think that's part of what really causes a great deal of fear for people. And that's not ignoring the fact that inequality is a serious issue in the country. It's not ignoring the fact that we've let our schools K through 12 become or never even emerge as viable enterprises for many students in the country. It's not to say that we shouldn't do something about student debt. It's just to note that when you add all these things together, they're all big, and it would require a transfer of the economy of the sort that we've never seen before. And I'm always reminded when I did my first book, Legislating Together, on the White House and Congress, and I was interviewing a bunch of people who were working in the then Reagan administration or had worked in previous administrations from Eisenhower on through Reagan. One of the senior Republican White House people, one of the most prominent people in the realm of White House advising and politics, whom I interviewed, said to me, a president can only do a certain number of things in any given time. You might be able to do 3 things. And so you really have to have a focused agenda. Now, imagine if you're only doing 3 things, and those 3 things are, I don't know, Medicare for all, $1 trillion infrastructure, and getting rid of all student debt. Even that is an enormous amount to ask. And look what happened to Barack Obama coming in with the financial collapse. And he does get the ACA. He does get a few other things moved through. He completely sets aside immigration reform and ends up failing on that. Yeah. He gets a cap and trade out of the House, but can't get it in the Senate. So even with all the wind behind his back of enormous numbers of Democrats coming into Congress in 2006 and 2008, he had the largest popular vote margin for an incoming Democrat since 1932 and Franklin Roosevelt. Even with all those elements, he still could only get an ACA, which was this slender down version of democratic healthcare reform, partial movement on the environment, complete failure to get on the agenda in a serious way, immigration reform, and a number of other issues. So it's again trying to figure out how you move from good ideas and expansive ideas to something that can actually be done in the system without losing hope that there's progress to be made.
A couple of things in what you've said a lot there. And by the way, one of the ironies of 2008 was that the Republican Party coalesced around a much more cohesive oppositional frame that, like immigration reform, had the Republican Party of 2010 and 2012 and 2014 looked like the Republican Party of 10 years before, you would have gotten immigration reform. It came close, but they couldn't get, there were not enough Marco Rubios left. One thing it does seem on your revenue point, what a real progressive agenda needs is a strategy to substantially increase government revenue in a way that is actually feasible. So like a value-added tax and a carbon tax would be the foundation for whatever you want to do. Because essentially, even if you had a really, really disciplined healthcare system, you enact Medicare for all, and you really clamp down on prices, you basically have to double the amount of additional federal revenue needed is on a par with doubling the federal income tax.
Yes, absolutely.
And that's a huge lift. And so we have to think about how to rocket science is more fun when you have rockets, and in this case, rockets is money in the cash register in the federal government, and that's I think that's the real. In fact, a lot of people thought that. I mean, that was the real vulnerability with Sanders. It wasn't some statement he made about Fidel Castro, in 1985. It was this is how much your taxes would have to increase to just do this,
Well, and what he was unwilling to do, or has been unwilling to do, and even Elizabeth Warren was unwilling to do, because it is the Death Star of American politics, is talk about how you actually do finance these things. And in a manner of speaking, they want, and frankly, I personally want as well, the Nordic model, the Denmark, the Sweden, where you have, more on Elizabeth Warren's side, a robust capitalist market economy mixed with a strong social welfare state financed through taxes.
Mm-hmm.
And the way you finance that through taxes is not to think you're going to go get it all out of a couple of percentage point wealth tax on billionaires, but is a broad-based tax that everybody pays, but they get something real in return. And they get an enormous amount of security and opportunity in return. And so there isn't this sense of hatred towards the tax system, because the tax system is allowing them to get things for themselves and their families that otherwise couldn't exist. And we just have not been able to have that conversation in this country. It's middle class people have to pay more in taxes in order to get something that is much bigger for them in a way, which is all the opportunity and security that comes wrapped up in those programs. And they will be better off financially in the end of all that, but it's not going to happen by saying somebody else is going to pay for all this and you're going to get it. That's just not, particularly if you're talking, as you say, the math, the simple math is effectively a doubling of the federal government's current size. And that's outside of World War II, that's hard to imagine.
Yeah, although I must say, as we sit dealing with COVID, there's a lot of things that are hard to imagine. I mean, but it does get back to the polls that you cited about the trust in government being so low that you have to be willing to say, here's this entity that we're willing to have double in size. So we're just entering the end game of this conversation, and I'm just wondering, what do you think the future is going to be of the ACA at this point? Your article talks about, you have this wonderful metaphor of Apollo 13 and we were sort of able to bring it back to Earth, but it was close, and you could have imagined it caroming off, hitting the atmosphere and skidding off or crashing. What do you think is the future of ACA?
Well, I have greater confidence that it in some form is going to be around. I do think that there is widespread understanding of deficiencies. And I even heard Zeke Emanuel the other day say they were just fundamentally wrong in the Obama White House to allow the crafting of insurance plans that have $8,000 deductibles for single people and $16,000 deductibles for family. Most people don't think of that as insurance. It may protect them from the catastrophic, but that's not really what people are thinking of when they're thinking about healthcare coverage. So something has to happen on that front. The public option we don't have yet, because there weren't 60 votes for the public option in the Senate back in 2009. Will there be votes for it? Well, obviously it depends entirely on what happens in the Senate, and there's no way they're going to be 60 Democrats in any form or version of being a Democrat in the next Congress. So that seems highly unlikely unless there is some fundamental transformation that goes on in people's understandings. And right now, COVID-19 and the coronavirus raise a really interesting issue. And you no doubt saw in the last debate between Vice President Biden and Senator Sanders, Biden making the comment, well, Italy has a single payer system and it hasn't stopped the problem. And he's absolutely right about that. What it does do is it means that people have health care once they're sick, although it doesn't mean they necessarily have enough ventilators and ICUs and all the things that are needed to deal with this kind of onslaught. And frankly, the one thing that Medicare for All in many ways leaves out, and it's something that my colleagues and I in the Old Blue Sky Initiative some years ago were really talking about, is we have to build up the public health and the population health
Yeah.
infrastructure of the country, as does every other country, because that's really where the assault comes in the form of these pandemics. And what we, even if we had Medicare for all right now, which would be much better in many ways than we are now, it wouldn't be stopping the pandemic. It would not be. It would not have in place what we need to really grapple with this kind of spread of a virus. And so, on the one hand, it might be the crisis that can be used to drive this policy issue, but it's not going to be really solving this policy problem if it doesn't address the larger issue, how you build a health and healthcare system. And one also, by the way, where we are able to build out enough capacity in the healthcare system that some of it's going to be idle a lot of the time in order to be able to take on these what's likely to be a series in a globalized society of pandemics that emerge from time to time.
You know, I wrote an article in 2009 in the New Republic where I was lamenting that the stimulus bill, the ARRA,
Right.
that it didn't do more for public health. And, you know, we have one of the things that's striking about Medicaid is that Medicaid is effectively the tool by which we do that. That there's more money in Medicaid for severely vulnerable populations. I'm a urban public health researcher. For people watching this who don't happen to know me, I do work with people that have addiction issues and mental health issues, and do prison-based work and jail-based work and so on. Medicaid dwarfs everything else with these populations in terms of where the real money is for supportive housing, for mental health care. And we have never really had the conversation, how do we make Medicaid into a real public health entity? So, for example, if someone has HIV, Medicaid will actually provides pretty generous coverage for HIV medications. I want to send outreach workers out to find people at risk of HIV and do public health outreach.
Yeah.
Medicaid doesn't pay for a lot of that. That's public health.
Right.
And we have not figured out how do we make sure that we have enough N95 masks and all that kind of stuff. It's just incredibly boring until there's a crisis. Nobody's even on the left, people are very excited about universal coverage. The supply side logistics of the ventilator market, I mean, who cares about that? That's somebody else's thing. And we really have to, COVID-19 is not the worst that we're going to see. When you think about climate change and you think about so many things that are happening, in fact, I think there's two things that, I mean, I'll put this down as a marker for the next time we have a conversation for Jay Hipple. There's two things that I find heartening about this, what we're going through now. One is there's a lot of social solidarity and ordinary people doing things and people stepping up to help. Especially in the absence of more effective national leadership. But the second is it's a wake-up call for what we're really going to see. If you think about what climate change is going to bring in terms of refugee flows, in terms of pandemics, in terms of rising sea levels, which is going to create havoc for some of the wealthiest cities in the world, Miami, New York. We have to be ready. And if we learn from this, that, our life could really change, and our 401ks, by the way, could really plummet. So we better all pay attention to these boring things. I think if this becomes a wake-up call, then it will be generative of some really important things that we need to do. And, because we do take for granted the biological ecosystems in which we live and their interactions with human beings, and we can't. And it is. I mean, we're actually spending $3.6 trillion right now on American healthcare, and that we have. You compare even a fairly crummy hospital. Just go in Los Angeles to a somewhat crummy or gritty public hospital. Just walk to the local health department that's the closest building to it.
Yeah.
The difference in the amount of money that's being spent, the difference in resources, the difference in professionalization, the difference in public exposure, it is sickening. And like in our fancy children's hospital, this wonderful fish tank, that costs more than the building that many of the organizations that I work with are in.
Yeah.
And this is my Jeremiah for which I'm going to close, but I think that your point that public health has to be, and population health has to be front and center, uh, that is a very striking failure. And I do think by and large, by the single payer folks do better with this than we do. Uh, but but if we did a single payer the way we do other healthcare, it would not be enough. And boy, we got to raise our game in the next generation, because that's a big challenge. It's not just universal coverage.
That may be the next 10-year issue of Jay Hipple, about 10 years after COVID-19. Where are we with public health and population health?
I hope that I hope that you and I will be there to have another conversation. I'm going to stop the recording now. It is always wonderful to speak with you and to learn from you, Mark. And you have a wonderful article, and I look forward to speaking with you again.